So things are getting worse. One woman miscarried in the restroom lobby of a Texas emergency room as front desk staff refused to admit her to the hospital. Another woman learned that her fetus had no heartbeat at a Florida hospital the day after a security guard turned her away from the facility. And in North Carolina, a woman gave birth in a car after an emergency room couldn't offer an ultrasound, and the baby later died. Complaints that pregnant women were turned away from U.S. emergency rooms spiked in 2022 after the U.S. Supreme Court overturned Roe v. Wade, federal documents obtained by the Associated Press reveal. The cases raise alarms about the state of emergency pregnancy care, especially in states that enacted strict abortion laws and sparked confusion around the treatment doctors can legally provide. It's shocking, absolutely shocking, said Amelia Huntsberger, an obstetrician gynecologist in Oregon. It's appalling that someone would show up to an emergency room and not receive care. This is inconceivable. And it has happened despite federal mandates that the women be treated. Federal law requires emergency rooms to treat or stabilize patients who are in active labor and provide a medical transfer to another hospital if they don't have the staff or resources to treat them. Medical facilities must comply with the law if they accept funding from the federal government Medicare program. The Supreme Court will hear arguments next Wednesday that could weaken those protections. The Biden administration has sued Idaho over its abortion ban, even in medical emergencies, arguing it conflicts with federal law. One's in chat if you know the current abortion laws in your state if you're in the States. Zero's in chat if you do not. You don't know the state of abortion. Two's in chat if you know a little bit, but not the details. And if you are familiar, is it illegal in your state? Are there exceptions? What does it look like for you? Where are you and what does it look like? I'm originally from Indiana. We had a pretty high profile case right before our anti-abortion stuff kicked in, where someone had traveled to get care in Indiana. It was a whole mess. It was actually having to do with a minor. It was disastrous. But Indiana has been anti-abortion for quite a while. It doesn't surprise me that they have gotten rid of that. On the other hand, I now live in Maryland, and the response to it has been drastically different. The main news I've gotten is that Maryland had actually started saying nurse practitioners can learn to give abortions and provide abortions because Maryland understood that there was going to be an influx of people traveling for abortions. And so they said, hey, look, abortion is one of the safest procedures someone can get. And so we're going to say we can have nurse practitioners also start performing them, training to perform them and performing them so that there is increased access to care. One of the things that was consistently an issue in my in my home Indiana state was lack of providers because of a range of issues. And one even got stamped out of just having access to the initial meeting in Indiana, Fort Wayne, Indiana, had to close down that clinic that was trying to help people get access to the first check-in, the ultrasound, the things you have to do like 24 hours before you get an abortion. So helping people deal with the difficulties of travel, because from Fort Wayne, you had to travel 3 hours to get access. In a lot of states, that is quite a large problem. So Maryland, responding to that issue. You can't legislate morality. It's a whole mess. It absolutely is. One of the things that struck me is my cousin brought it up over breakfast one morning, and her thing was absolutely that doctors can be wrong, and therefore, no, you can't provide exceptions for the life of the pregnant person. Someone's morality is wanting to get legislated, and with what I would claim is horrifying consequences. Horrifying consequences. But what can I say? I'm just a goofy little streamer. What do I know, It's very illegal here unless it's done to preserve the life of the mother. Something pretty interesting, though. Government workers in Salt Lake City are able to travel to Nevada or Colorado for free to get an abortion if they choose so. Government workers. Interesting. Arkansas allows for abortions if the life is in jeopardy, which is at the doctor's discretion. So we'll talk a little bit about that in a while as well. All right. Thanks for your thoughts, chat. Looks like California. I'm in Utah. Not sure how Minnesota is doing. Yeah, Sanaville, you should really keep updated on the state you're in, honestly. Geez. Fairly certain it's legal in Hawaii, but I'm not sure if there are any niche restrictions. Likelihood is probably. Most places have some degree of restriction. Some degree. Here in Norway, there's a debate ongoing with the likely outcome being the entirely self-determined period being extended by 3 weeks from conception. At least that's the medical recommendation the government is supporting. The entirely self-determined, okay, interesting. 3 weeks from conception. So is it already, it's out from, they're not saying 3 weeks from conception, that's when you can decide, are they? That's not the window they're giving, are they? They're extending that window. Do you know what the window is currently? Because 3 weeks out from conception is absolutely unhinged. A lot of people don't know until the 4th to 6th week, sometimes even further. Currently 15 going, okay, I was going to say, wow, I would be surprised if that was the case. You're in Norway? Why did I not know that, Magos? Interesting. By that logic, everyone can be wrong, so nothing can be law, and police can be wrong, so ACAB. I hear what you're saying. You did know that. No, I didn't. Fight me. What are you going to do about it, huh? It's a morbid thought indeed. It went illegal the moment they could pass it, yeah. Supreme Court will hear arguments next Wednesday that could weaken those protections. The Biden administration has sued Idaho over its abortion ban, even in medical emergencies, arguing it conflicts with the federal law. No woman should be denied the care she needs. Oh, that was one of the big points, though, was that rape, even in the case of rape or the mother's health, some of these states are not even giving those exceptions, which meaningfully those exceptions are really, really hard to maintain for the people seeking them, but also it's just not enough. No woman should be denied the care she needs, Jennifer Klein, director of the White House Gender Policy Council, said in a statement. All patients, including women who are experiencing pregnancy-related emergencies, should have access to emergency medical care required under the Emergency Medical Treatment and Labor Act, Emtala. So this Emtala is basically, if you go into an emergency care center, they have to serve you if you are not stable. And that ended up including people who may be going into labor, people who may be going into labor, like you're supposed to be able to get in. Pregnant patients have become radioactive to emergency departments in states with extreme abortion restrictions, said Sarah Rosenbaum, a George Washington University health law and policy professor, adding, "They are so scared of a pregnant patient that the emergency medicine staff won't even look. They just want these people gone." A woman who was 9 months pregnant and having contractions arrived at the Falls Community Hospital in Marlin, Texas, in July 2022, a week after the Supreme Court's ruling on abortion. The doctor on duty refused to see her. The physician came to the triage desk and told the patient we did not have obstetric services or capabilities. Hospital staff told federal investigators during interviews, according to the documents. The nursing staff informs the physician that we could test her for the presence of amniotic fluid. However, the physician adamantly recommended the patient drive to a Waco hospital. Investigators with the Centers for Medicare and Medicaid Services federal agency concluded that Falls Community Hospital broke the law. Reached by phone, an administrator at the hospital declined to comment on the incident. An investigation was one of dozens the AP obtained from a Freedom of Information Act request filed in February 2023 that saw all pregnancy-related Emtala complaints the previous year and 1 year later received limited results from just 19 states. Federal investigators looked into just over a dozen pregnancy-related complaints in those states in the run-up to the Roe ruling, but more than 24 complaints in the months following. It is not known how many complaints were filed last year, as the records request only asked for 22 complaints, and the information is not publicly available otherwise. The documents did not detail what happened to the patient turned away from the Falls Community Hospital. Other pregnancies ended in catastrophe, the documents showed. At Sacred Heart Emergency Center in Houston, front desk staff refused to check in one woman after her husband asked for help delivering her baby that September. She miscarried in a restroom toilet in the emergency room lobby while her husband called 911 for help. She's bleeding a lot and had a miscarriage, the husband told the first responders in his call, which was transcribed from Spanish in federal documents. I'm here at the hospital, but they told us they can't help us because we are not their client. Emergency crews, who arrived 20 minutes later and transferred the woman to a hospital, appeared confused over the staff's refusal to help the woman, according to 911 call transcripts. Our first responder told federal investigators that when a Sacred Heart Emergency Center staffer was asked about the gestational age of the fetus, the staffer replied, "No, we can't tell you. She's not our patient. That's why you are here." A manager for Sacred Heart Emergency Center declined to comment. The facility is licensed in Texas as a freestanding emergency room, which means it is not physically connected to a hospital. State law requires these facilities to treat or stabilize patients, a spokeswoman for the Texas Health and Human Services agencies said in an email to AP. Sacred Heart's Emergencies website says it no longer accepts Medicare, a change that was made sometime after the woman miscarried, according to publicly available archives of the center's website. So one of the things I didn't recognize, first off, one's in chat if you've heard of Emtala and you knew what Emtala was. Zero's in chat if this is your first time learning what Emtala was. I was just learning about it going through what's happening here, that if an emergency room accepts Medicare, Medicaid, they have to take in patients who are not stable. They have to stabilize patients. And that includes people who are pregnant and potentially unstable in that pregnancy. Obviously, what you see happening here is this group is no longer accepting that. You're seeing these abortion laws actively chipping away at maternal health care, actively chipping away at health care for those that they claim to care about, right? We care about mothers so much. We think they shouldn't be able to make this decision, whether it's for their health, whether or not they've been raped. We're going to assume why they are doing it. We're going to say some of them are even, have you heard the people who are like, bring back consequences for having sex? Like at that point, just acknowledge that you want control over women's bodies. You want control over bodies that can get pregnant. Like just acknowledge you don't really care about these people. You just care about them having babies. That's what it is.